Hey friends, Dr. Joe Kraft again with part 2 of fever in children. All right, now how to check a child's temperature is what we're talking about today. It's very important. The core temperature is the rectal temperature. That's going to be the best temperature. That's our most accurate evaluation of core temperature in anybody, but particularly a child. That temperature is very important, and being specific and very exact in measuring temperature is very important in children less than 3 months of age, where they don't have an intact immune system yet. So we check rectal temperature in small children, or we can consider other ways of checking the temperature, such as oral in the mouth, axillary in the armpit, maybe a tympanic temperature measuring the eardrum, or even on the skin. The problem with all of these other ones is that they can be influenced by the ambient air temperature, which is almost always cooler than 98.6 in at least where I work. So if we're used to being in cooler temperatures like indoors, the air around us, or if we drink something cool, it'll lower the oral temperature. Sometimes with the ear thermometers, they're not getting a good look. It takes a little bit of effort to get a good look at the tympanic membrane to get a good measurement. So I usually recommend checking it multiple times in different areas and taking the highest temperature. The highest temperature is going to be most likely the closest to core temperature. And so I want to make sure that when a child comes in, if they're being brought in for fever and I look at the vital signs and it says they don't have fever, but when I put my stethoscope on their chest, they're cooking hot, then I recheck their temperature and I can usually find a temperature that is much warmer than what was charted. So all of that to say, lots of ways to check the temperature. It doesn't make too much difference exactly what it is. I just like to categorize as no fever, low grade fever, or high fever. And if it's a child under 3 months, or if they have an immune compromised situation, then we need to know exactly what the temperature is. Otherwise, just those 3 categories is good enough. Hope that helps a little bit. Stay tuned for part 3.